Hi everybody, this is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum. This is the basic emergency care course. This is our second session in shock. This session is about secondary survey. The objectives: recognize sign of shock and poor perfusion, perform critical action for patient with shock, assess fluid status, select appropriate fluid administration based on patient age, weight, and condition, recognize malnutrition, anemia, and burn, and adjust fluid resuscitation accordingly. Remember that shock happens when there is poor perfusion. This can happen before blood pressure fall. As we mentioned, those with strong sympathetic outflow, usually the drop of blood pressure happen late. Low blood pressure with poor perfusion is a very bad sign. It means that it is decompensated shock. Initially, you start with ABCD approach to identify and manage life-threatening conditions. Then you go through sample history and then you do secondary survey looking for changes in patient's condition or less obvious causes that might have been missed on the initial survey. During the secondary survey, breath sounds and respiratory rate, abnormal or noisy breathing can indicate pneumonia. High blood sugar with cosmal and acidotic breathing can happen in diabetic ketoacidosis, and in this patient you see high blood sugar, increased urination, and sweet or fatty smelling of the breath. You have to look for bleeding, external bleeding. Whenever there is an obvious external bleeding, you have to apply pressure and consider concealed or hidden bleeding from vaginal bleeding in pregnant or childbearing age ladies, and also bleeding in the stomach and intestine. Difficulty in breathing can happen in both patients with dehydration and fluid overload. Patient with dehydration, usually they feel thirsty, they have dry lips and mouth, abnormal skin pinch, lethargy, delayed capillary refill. These patients, because of shock and acidosis, they can have tachypnea and shortness of breath. While those with fluid overload, they manifest as bilateral limb edema, distended neck veins, presence of crackle inside the lungs. Look for anemia. People usually have pink inside of the eyelid. Those with anemia, they have pale conjunctiva, which can signify blood loss or chronic anemia. Check mental status. Confusion, irritability in patient with poor perfusion suggests severe shock. Patient with fever and poor perfusion can indicate septic shock. Low blood sugar can sometimes look like shock without low blood pressure. Give glucose whenever it is less than 3.5, and when you suspect hypoglycemia, if you cannot check blood sugar in patients with altered mental status and history of diabetes or at risk of hypoglycemia, you have to treat and give glucose. Check for severe abdominal pain and abdominal distension. Pain can indicate intra-abdominal bleeding or intra-abdominal infection, and in pregnant lady, this could be feature of ectopic pregnancy, ruptured ectopic. Check urine color and volume. A small amount of dark urine suggests dehydration. Assess stool. Check stool. Diarrhea can lead to dehydration and sometimes can go to shock. Large amount of watery rice water stool suggests cholera, which can also lead to dehydration and shock. Those with black, dark, or reddish stool can indicate stomach or intestinal bleeding. Check for malnutrition. Malnourished patient requires specialized rehydration plan. Be sure to ask about any recent weight changes. Look for swelling in the mouth and hives, which can indicate allergic reaction. Other skin rash could signify infection and sepsis. Bilateral lower limb edema can indicate heart failure. Sweating can occur in moderate to severe shock because of sympathetic outflow. After we do the ABCDE approach and stabilize the patient, take sample history, and then we do detailed examination, We would like to put the pieces together to figure out the possible cause of shock. Poor perfusion due to fluid loss. There will be increased fluid loss due to vomiting, diarrhea, or excessive urination. These patients have dry mucous membrane, they have tachycardia, they have tachypnea, there is abnormal skin pinch and decreased ability to drink water. Poor perfusion due to fluid loss. In case of diabetic ketoacidosis, patient can have history of diabetes. He has frequent urination, high blood sugar, and also high sugar in the urine. They show feature of dehydration, cosmal breathing, deep and slow breathing, and frequent micturition. And also there can be some feature of concomitant infection and sepsis. Poor perfusion due to blood loss, external bleeding, could be history of injury, active bleeding, and use of blood thinner put patient at risk of bleeding. Large bone fracture, history of injury, pain or instability of the pelvis, blood at the opening of the urethral meatus or in the rectum, deformity or crepitus of the femur, shortening of one leg. All these can indicate femoral fracture. Poor perfusion due to blood loss. If the source is intra-abdominal, you can find there is abdominal pain, distended and firm abdomen, plus you can see bruising around the umbilicus on the flank. While bleeding in the stomach and intestine, patient can show feature of shock. There could be history of hematemesis and melena, black vomitus or black stool. Patient can have history of alcoholism, schistosomiasis or cirrhosis, plus use of blood thinner. Poor perfusion due to blood loss, hemothorax. This patient can have difficulty in breathing, plus you will find dull percussion note and reduced breath sound on the affected side, and they can have feature of shock. Poor perfusion due to blood loss in childbearing age ladies with history of pregnancy or missed cycle with abdominal pain and vaginal bleeding. This could be a rupture ectopic. Those who recently deliver, when they have heavy vaginal bleeding, they have to change the pads frequently, and constant trickling of blood or loss of more than 250 ml, or when there is delivery outside and when you find the uterus is soft, you have to suspect postpartum bleeding. Poor perfusion due to fluid loss, burn. In burn, people lose significant amount of fluid. Skin could be red, white, or black, depend on the depth of the burn. May have blistering, and these patients also are at risk of inhalation injury, so don't forget to assess airway and breathing. Burn injury can cause excessive fluid loss through the damaged tissue, and patient can become severely dehydrated and shocked. Poor perfusion due to dilated blood vessels, infection and in severe infection and sepsis. Patient can have feature of fever, tachycardia, tachypnea, and hypotension. Plus, there is a sign suggesting site of infection. Could be skin infection. It could be pneumonia with crackle inside the lung, urinary tract infection presenting with dysuria and burning micturition, or any other source of sepsis like meningism and intra-abdominal sepsis. Poor perfusion due to dilated blood vessels can happen in spinal cord injury, spinal shock. There could be history of trauma, spinal pain and tenderness, vertebral not aligned. You can feel crepitus by touching the spine, loss of movement, paralysis, weakness or abnormal reflex or loss of sensation below the site of injury. Also, patient not able to control the urine and stool. Some patient can have periapism. Patient will have hypotension, bradycardia, and when there is high cervical injury, they can have also difficulty in breathing due to diaphragmatic paralysis. Poor perfusion due to dilated blood vessels in severe allergic reaction. There will be swelling in the mouth, tongue, and face. Patient can have difficulty in breathing, stridor and wheezes. There will be skin rash and hives, tachycardia, and hypotension. Poor perfusion due to heart problem. In case of heart failure and cardiogenic shock, there could be difficulty in breathing with exertional dyspnea and orthopnea. swelling of both legs, distended neck vein, crackle inside the lung, and when it is due to heart attack, there can be chest pain. Poor perfusion due to heart problem. When it is due to heart attack, cardiogenic shock secondary to myocardial infarction, patient can have chest pressure, tightness or crushing chest pain, diaphoresis and mottled skin, difficulty in breathing due to pulmonary edema. At the same time, they can have nausea, vomiting. Pain can radiate to the left shoulder or the jaw, and you can see finding of heart failure like third heart sound and tachycardia and gallop. History, presence of risk factor like smoking, cardiac disease, hypertension, diabetes, high cholesterol, or family history of cardiac problem. Poor perfusion can also be related to other cardiac problem, abnormal rhythm, severe tachycardia or severe bradycardia plus irregular pulse. Heart problem also like valvular disease can present with cardiogenic shock, especially acute valvular disease when it is damage due to myocardial infarction, trauma, or endocarditis. Patient can have history of rheumatic fever, and you might hear murmur during examination, plus feature of poor perfusion and shock. Perfusion due to heart problem, as in pericardial tamponade. Patient can show finding of poor perfusion like tachycardia, tachypnea, hypotension, pale skin, cold extremities, and at the same time you see distended neck veins, muffled heart sound. They might have dizziness, confusion, altered mental status. There could be some risk factor like tuberculosis, trauma, malignancy, or renal failure. Poor perfusion due to heart problem, as in tension pneumothorax, high pressure shift large blood vessels in the chest, blocking cardiac filling. Patient will have hypotension, what we call obstructive shock. At the same time, they have difficulty in breathing, absent breath sound in the affected side, hyperresonance with percussion on the affected side, and at the same time, you see distended neck vein, and trachea could be shifted from the affected side. Take home in patient with shock or suspected shock or poor hypoperfusion, always start with ABCDE. Then after you stabilize the patient, do sample history, and then you do detailed exam and secondary survey to look for any overlooked abnormalities. The goal is to identify causes of poor perfusion, whether it is due to fluid loss as in vomiting, diarrhea, excessive urination, or burn. If it is due to blood loss, external and obvious blood loss, or internal blood loss as that in chest, abdomen, or pelvis. You would like to figure out if the hypoperfusion due to dilated blood vessels as in shock, in septic shock, anaphylaxis, and cervical cord injury. If it is due to cardiogenic as in myocardial infarction, cardiomyopathy, arrhythmia, or valvular disease. And if it is obstructive shock as in tension pneumothorax, tamponade, and pulmonary embolism. Thank you, and see you in the next session about how we manage these conditions.